Hello everyone and welcome welcome to this audio podcast. This audio podcast is part of a Bostix series. This audio podcast as part of a LaBox Infaction, and this audio podcast as part of a Storm LaBox production. And this audio podcast as part of a Storm quota. This audio podcast we're looking to the healthcare service provision aspects of this works. So there had been a push for using technology to bring and bridge sort of knowledge gaps in healthcare, peer support, and education. But further research still needs to sort of explore guidance and areas of peer support and patient education. And in this in and patient education, it is in this context that there is also a requirement to evaluate guidelines for patient and public involvement and focus on where commissioning is wanting. And what is yet to be investigated is where healthcare service provision could also include e-health and e-learning modules wherein patients and professionals co-develop online learning through social media platforms. The UK government has emphasized the importance of tech in improving healthcare outcomes and offering more patient-centric care. Such initiative could be supplementary in healthcare documentation that already exists. So, for example, as part of electronic patient records or EPRs. Of course, any healthcare service provision education provided would also require documenting and transfer of information, connectivity of any future tech or links between EPRs. Service provision can be linked and integrated between social media platforms and or online learning to integrate with EPRs to ensure interoperability and compliancy, for example, linked to general data protection regulation practice and guidelines. There is also more need to improve healthcare education for patients with LTCs, long-standing conditions, and this has been one of the most challenges facing the National Health Service, the NHS. And with advances in point of care, improving care for people with long-standing conditions would involve a shift from a reactive disease-focused, fragmented model of care towards a more proactive, holistic, and preventative, wherein both patients and healthcare professionals are encouraged to play a centric role. Processes have also led often have also led to often inadequate healthcare and also resulting in miscommunication and insufficient service provision. Primary care also uses criteria agreed in local guidelines to request advice or question the need for hospital clinics. And this can lead or has led to had led to sort of multi-morbidity, which has a negative which has and can have a negative impact on access to healthcare. Primary care records are generally at the same time not accessible to secondary care healthcare professionals, and consequently telephone calls and referral. Certainly, access again to EPRs does not guarantee that patients know how to use the information, and there is little understanding again of how effective consultations are. Patients want more understanding in a range of areas and require AHPs, allied health professionals, to be part of discussions where they can get get more sort of robust care accordingly, and by encouraging education and relating context across a range of health disciplines. This would reduce inequity, increase literacy in language, and improve overall healthcare in the CKD population. That draws this audio podcast to a close. This audio podcast as part of a Bostix series, this audio podcast as part of a LaBox Infaction. this audio podcast as part of a Storm Quota, and this audio podcast as part of a Storm LaBox production.